The next topic is discussing some of the cranial nerves which are passing through the various foramina in the skull. You will see that we are going to draw a diagram for the same purpose, and it is looking at the cranial cavities from the superior view. You see, we are first drawing the midline of the body and telling that this is the nose anterior. Now, when you are shown the nose anterior, understand that if that is anterior, then this will be the right side of the body, because you are looking from superior view and you are telling this is nose anterior. If that is the nose anterior, then this will be the right side of the body and right ear will be on this side, that orientation. Now, this is the cranial cavity we are looking at and the superior view, so that we can discuss some of the openings. We are drawing the midline of the body here and telling that this is the nose anterior. Now, when you say this is nose anterior, it is the superior view of the cranial cavity we are talking about, and then we will be looking at some of the openings in the skull, so that some nerves passing through that can be discussed. In fact, what you find is there will be one anterior cranial fossa, middle cranial fossa, and the posterior cranial fossa. We are looking at the anterior and the middle and the posterior cranial fossa and the floor. So, floor of the anterior cranial fossa, what will you notice? At the floor of the anterior cranial fossa, what we notice is some cribriform plate of the ethmoid bone. And this cribriform plate of the ethmoid bone is actually having multiple openings. And what are those multiple openings for? See, if you're talking about the floor of the anterior cranial fossa, and you tell that this is the cribriform plate of ethmoid bone, it is also the roof of the nasal cavity. And from the roof of nasal cavity coming the axons of the cranial number 1, which is olfactory nerve, passing through various openings in the cribriform plate of ethmoid to come to the olfactory bulb in the brain. Then we have told that there will be the frontal bone, which is at the roof of the orbit. If you say this is the frontal bone, which is at the roof of the orbit, there is one more bone contributing. Who is that? The roof of orbit contributor by 2 bones, and the other bone is called as the lesser wing of the sphenoid. Now, if that is the lesser wing of sphenoid and 2 bones contributing to the roof of the orbit, what is inside the orbit? Inside the orbit, you have the eyeball. Now, if you say this is the eyeball, let us assume this is the eyeball covered by some sclera. So, we are now showing the eyeball in the orbit, and we are telling that it will be covered by some sclera. How do I reach the eyeball? You have to break the frontal bone, and deep down there will be the eyeball covered by sclera. Now, what is behind the orbit? Behind the orbit is a fissure, and we are calling it as the superior orbital fissure. If you say this is the superior orbital fissure which is behind the orbit, it is actually a gap between the 2 wings of the sphenoid. Which one? You know that there will be a greater wing of sphenoid. And what about the greater wing of sphenoid? It is at the floor of the middle cranial fossa here. So now you are looking at the floor of the middle cranial fossa. Yes, actually, floor of the middle cranial fossa, you'll find the greater wing of the sphenoid. And where is the lesser wing of sphenoid? At the floor of the anterior cranial fossa. You mean to say there is a gap between anterior and middle cranial fossa? Yes, in fact, it is also a gap between lesser wing, greater wing of sphenoid. So that is the superior orbital fissure. Yes, some nerves are passing, some veins are passing. We have to discuss them now. As you're talking about the floor of the middle cranial fossa, you know there was a sella turcica, and sella turcica is actually in the body of the sphenoid. And what is inside the sella turcica? The pituitary gland in the midline. So you're telling that there will be some pituitary gland in the midline. Yes. In the body of sphenoid. right? At the floor of the middle cranial fossa, yes. And that structure, which body of sphenoid form the sella turcica, right? What is lateral to sella turcica? That we will be discussing, but first you see, what is this fissure? Superior orbital fissure. On the superior orbital fissure, you will see there is a common tendinous ring of Zinn. What is that? Common tendinous ring of Zinn. Why are you telling it is a common tendinous ring? It is on this side, that side, both side you can show. So we are showing this is common tendinous ring of Zinn. On the left side, superior view of the cranial cavity, yes. And right side, superior view of cranial cavity, yes. It is called common tendinous ring of the Zinn because it is the common tendinous origin of the four muscles: superior rectus, inferior rectus, medial rectus, and lateral rectus. So four recti muscle take origin here. If you say four recti muscle take origin here, where is the insertion then? Sclera of the eyeball. All muscles insert into sclera of the eyeball. So common tendinous ring of Zinn, which is on both sides, will give you origin to four recti muscles, and they'll be inserting into sclera. Let us follow one of them. Which one? Let us say LR6. What is LR6? Lateral rectus supplied by sixth nerve. When you say you are following lateral rectus supplied by sixth nerve, what is the origin insertion? That we will show now. And you can tell this is the origin and that is the insertion. So you are talking about lateral rectus muscle now. Yes. Lateral rectus muscle, the origin insertion. Origin is the common tendinous ring of Zinn and insertion is the sclera of the eyeball. Now remember, wherever the rectus muscle are inserting, just behind the insertion is the thinnest sclera. Thinnest sclera. One question came, where do you have the thinnest sclera? Understand, the thinnest sclera is just behind the attachment of any of the four recti, maybe lateral rectus or maybe superior, inferior, medial rectus. Wherever the four recti insert, just behind the insertion will be thinnest sclera. That you remember. Okay, then what is the next thing to do? You see, we'll find some diagrams regarding that later, but here, what is this gland in the midline? Pituitary. What is lateral to pituitary? You mean to say in the middle cranial fossa? Yes, middle cranial fossa. What is lateral to pituitary? The cavernous sinus. If you say this is the cavernous sinus on the right side and the left side, what is cavernous sinus? Cavernous sinus is a dural venous sinus collecting venous blood of the brain. So it has many tributaries, and not only brain but other areas drain here. Who other areas drain there? Like orbit. So orbit is draining into cavernous sinus. How? By some veins. What are the tributaries to the cavernous sinus from the orbit then? Actually, cavernous sinus will have many tributaries and we will discuss two of them now. Superior ophthalmic vein and inferior ophthalmic vein. So you are mentioning they come from orbit? Yes. You're talking about the tributaries, incoming channel to cavernous sinus. Yes. And from the orbit, you have superior ophthalmic vein, inferior ophthalmic vein. Can we show them now in the diagram? Of course, we can do that. See here. This is going to be inferior ophthalmic vein and that is going to be the superior ophthalmic vein. You mean to say superior ophthalmic vein is lateral? Yes, it is. Superior ophthalmic vein is laterally present and the inferior ophthalmic vein is then medial. So this is the lateral superior ophthalmic vein which is draining the orbit into cavernous sinus. Yes, and this is inferior ophthalmic vein which is draining the orbit into cavernous sinus. But I remember that their Gray's anatomy was telling superior ophthalmic vein is a bidirectional flow. Yes, it has bidirectional flow and it is draining cavernous sinus into orbit. So superior ophthalmic vein has bidirectional flow and it will drain the cavernous sinus into orbit. So that means superior ophthalmic vein is not only a tributary into the cavernous sinus, but it is also a draining channel for cavernous sinus. It can drain the cavernous sinus back into orbit. And if you remember, we have discussed earlier, it's a dangerous communication. How come? Because it can bring the bacteria here. Which bacteria? Staphylococcus aureus. Where is that? On the nose, you remember? Nasal pustule. So when we were discussing the nasal pustule, there was some Staph aureus. Where? In the facial vein. And from the facial vein, where it is going? Angular vein. From the angular vein, where it is going? Superior ophthalmic vein. From superior ophthalmic vein, where it is going? Cavernous sinus thrombosis. If you remember, we have discussed the dangerous area of the face. What is that? See, there's a patient having a nasal pustule. Okay, a Staph aureus infection where making septic emboli facial vein. And where is the septic emboli facial vein going? Into angular vein near the angle of the eye. And angular vein will send the septic emboli where? Superior ophthalmic vein causing cavernous sinus thrombosis. So it is a dangerous communication. Can't it be inferior ophthalmic vein? Yes, it can be. Bacteria can pass through inferior ophthalmic vein, but superior ophthalmic vein is most commonly involved. Can you see one thing here? Superior ophthalmic vein, inferior ophthalmic vein, they are passing the superior orbital fissure, but they stay outside the ring of Zinn. But why they are staying outside the ring of Zinn? Why don't they go inside the ring of Zinn? Because they don't want to get compressed. They don't want to get compressed in this narrow space. So it's preferable that they stay outside the ring of Zinn when they are passing superior orbital fissure. Some people, some population, they might be inside the ring of Zinn, but usually they are outside. What else is passing superior orbital fissure? That is some nerves which we have to discuss. Now, once you have this kind of information with you, let us talk about the nerves then. Yes, we have to discuss the nerves also. And as you are doing that, you will be looking at one more diagram. So we will have to draw one more diagram. And as you are drawing that diagram, that particular diagram, before that you see the dangerous area of face. What is that? This dangerous area of face. So you are telling about dangerous area of face now. Yes. What does it include? It includes the upper lip and nose and medial canthus of the eye. Medial canthus of the eye. What is at the medial canthus of eye? Let us see. You see, there was a nasal pustule and causing septic emboli in the facial vein. And from the facial vein, where the septic emboli goes? Into the angular vein at the medial canthus of eye. And from the angular vein, where did the bacteria go? To the superior ophthalmic vein and into the cavernous sinus, causing cavernous sinus thrombosis. So what will happen when there is a cavernous sinus thrombosis? Raise intracranial tension and medial squint. Why would there be medial squint and raised intracranial tension? Why this eye is going to medial side? Because medial rectus is more powerful. But why the medial rectus is more powerful? Because lateral rectus is compromised. Why lateral rectus is compromised? Because there was raised intracranial tension. And the earliest nerve to get involved is sixth nerve. Earliest muscle to paralyze is lateral rectus. Understand? If you have a case of cavernous sinus thrombosis, there will be raised intracranial tension, and the earliest nerve to get involved in raised intracranial tension is the sixth nerve. And the sixth nerve is gone abducent, then LR6, that is lateral rectus is paralyzed. If lateral rectus is paralyzed, medial rectus is unopposed, more powerful. It is unopposed and more powerful. That is why the patient is having medial squint. After some time, you will find the eyeball will come back to neutral position. And that is called as external ophthalmoplegia. So you are telling that after some time, later in the course of the disease, later in the course of disease, there will be external ophthalmoplegia. Eyeball will come back to neutral position. Why it will come back to neutral position? Because after some time we see that almost all the nerves supplying the eyeball have been compromised. So all the muscles are paralyzed, which is called external ophthalmoplegia. So eyeball become still eyeball. It is not moving. So it will be a still eyeball and not moving at all? No. Eyeball becomes still eyeball. Can we discuss more about that? Yes, we'll do that. Definitely. But this is the briefing of cavernous sinus thrombosis, presenting with medial squint. Later, there can be more problems. Now, once we have talked about medial squint, fine. What is Again, you are looking at the transverse section of the head superior view. Yes, again, we are looking at the transverse section of the head superior view because we wanted to know some nerves passing through that. Nerves, like which nerves? You see, when you are looking at the superior view of the head, and it is a transverse section, we can see some of the brain structures, and also we have a view of the eyeball. But how can I see the eyeball? I must have removed some bones. Which bones you have removed from the roof of the orbit so that you can see the eyeball? There are two bones. One is called as the frontal bone and the other is called lesser wing of the sphenoid. They are the roof of the orbit. Now, when you are talking about the roof of orbit, there are two bones. You must have removed them. One is the frontal bone and other is lesser wing of sphenoid. Then only you can see the eyeball. Okay. What else you want to see? This is the muscle which we have drawn. Which one? Lateral rectus, LR6. So this is the muscle we have drawn, LR6. Okay, I remember. You were talking about some common tendinous ring of Zinn here. Yes, common tendinous ring of Zinn. And inserting muscle into sclera of the eyeball. Yes, muscles inserting into sclera of the eyeball. This is LR6. Now, if you say this is LR6, then there will be MR3 also. Yes, that will be MR3, medial rectus supplied by third nerve. So that is the medial rectus supplied by third nerve. Yes, this is medial rectus and that will be lateral rectus. So that kind of questions are coming. Actually, these days examiners will give you some diagrams similar to this and asking what is this muscle and which nerve is supplying. What is that muscle, which nerve is supplying. This is medial rectus, that is the lateral rectus. This is the optic nerve coming from eyeball. So you have to be careful about all these diagrams. You have to train your eyes to identify the structures by practicing more and more MCQs. Okay, fine. That will do. But at this moment, it was LR6, lateral rectus supplied by sixth nerve. And this is the bone of the nose. What is that? Ethmoid bone. So are you talking about ethmoid air sinus? Yes, ethmoid air sinus. You know, ethmoid is a pneumatic bone and this is the ethmoid air sinus. So if there is a fracture at the floor of an anterior cranial fossa, it will be filled with CSF. What is happening? If there is a fracture at the floor of the anterior cranial fossa, which is the roof of the nasal cavity, then there will be CSF in the ethmoid air sinus coming out of nose, which is called as CSF rhinorrhea. So this is the sinus which will be filled with CSF in case there is a fracture. What is this? This is the sphenoid air sinus. If you say this is the sphenoid air sinus, then is the sphenoid bone also a pneumatic bone? Yes, this is the one right half of the bone, this is left half of the bone. So this is left half of the bone, this is right half of the bone, and this is sphenoid bone, which is a pneumatic bone filled with air. Yes. I'll tell you one thing now. These two bones are forming medial wall of orbit. Actually, medial wall of orbit will have four bones. What are the two bones posteriorly? If you say medial wall of the, see, this is the orbit and medial wall of orbit will have four bones. What are the two bones posteriorly? One of them is body of the sphenoid, the most posterior. Most posterior is the body. This is the orbit. Inside that you have the eyeball, and the medial wall of orbit is having body of sphenoid most posterior, and what is more anterior? Ethmoid bone. Very thin bone, medial wall of orbit. And what is still in front? Still in front there will be lacrimal bone. And what will be still in front? What will be still in front will be the maxilla bone. So what are the four bones in the medial wall of the orbit that we have to discuss? Which is the most posterior? The body of sphenoid. What is in front of that? The ethmoid. And what is in front of ethmoid? The lacrimal bone. And then most anterior will be the maxilla bone. We will look at the orbit in some orientation as well later. Here, you tell me, what is this eyeball which is in the orbit having lateral wall of orbit? Lateral wall, yes. I think lateral wall, there are two bones. Yeah, tell me the names. Lateral wall of orbit, there are two bones, and one of them is greater wing of sphenoid. Yes, greater wing of sphenoid is the lateral wall of the orbit. If you remember, we have discussed sphenoid bone. If you remember, we have discussed the sphenoid bone contributing to orbit at three places. What was the roof? Roof was the lesser wing of sphenoid. And what was the lateral wall? Lateral wall was greater wing of sphenoid. And what was the medial wall? Medial wall was the body of sphenoid. If you remember, we have discussed sphenoid bone earlier as well. If you don't remember, don't worry, we'll discuss it again, because orbit is a complex structure. We have to repeat it again and again. Anyhow, what is this bone forming lateral wall of orbit? Greater wing of sphenoid. And what is the other bone in the lateral wall of orbit? Because there are two bones. If you're telling that there are two bones, then one more will be there, and that will be the zygomatic bone. Zygomatic bone. Zygomatic bone is the lateral wall of orbit. Yes. Let's draw a diagram and discuss the things again. What diagram you want to draw? I'm telling you that this is the midline of the body. Yeah, that is okay. This is the left orbit, right orbit. You mean to say you are drawing this orbit now? Yes, that orbit. Okay. If you're drawing this orbit now, right orbit here, you want to talk about the boundaries of the orbit? Yes. You tell me, what are the boundaries? You will see that there is one bone which is most posterior, body of sphenoid. And what is in front of that? In front of that, I have this ethmoid bone. And what is in front of ethmoid? That is the lacrimal bone. And what is in front of lacrimal bone? That is the maxilla bone. So there are four bones in the middle wall of orbit. Yes, you see body of sphenoid, and then ethmoid bone, and lacrimal bone, and maxilla bone. What is the two bones in the lateral wall? They are actually here. There is one which is the greater wing of sphenoid, and there is one in the front which is, yes, the zygomatic bone. Zygomatic bone. And which bone were there at the roof? You have removed the roof. Which bones? Roof. There were two bones. One is frontal bone, and the other is lesser wing of sphenoid. But why do you want to know all that? Because there are questions. Can we see some questions? Yeah, let us see some questions. Tell me the wrong statement. Wrong statement about the wall of the orbit? Yes. Okay, I'll see. I think roof is not only frontal bone, but also lesser wing of sphenoid. Yes. I think this is the wrong statement. That is the answer. Yes, because it is asking wrong statement. That is the answer. Because it is not the roof. Then what it is? It is actually lateral wall. So the greater wing of sphenoid is not the roof. It was lateral wall. Then you mean to say medial wall is ethmoid bone? Of course, not only ethmoid, but also body of sphenoid. And one more. Who is that? The lacrimal bone, maxilla bone. So medial wall is okay? Yes. The only problem is here. So we'll keep this answer. Yes, because roof is not greater wing. It is lesser wing. Greater wing is lateral wall of orbit. Some orientation you need. Okay. Can you tell me what is the answer to this question? Thinnest. You know already. So maybe it is lateral rectus, medial rectus, superior inferior rectus. All the four recti insert into sclera, and wherever they are inserting, just behind the insertion is the thinnest sclera. That we know the answer already. Okay, now we are looking at the left orbit here. So you are looking at the left orbit from superior view. Yes. When looking at the left orbit from superior view, what do you want to discuss? The diagram which we already have drawn. Which one? The lateral rectus muscle. So you are showing the lateral rectus muscle again. Yes. Why would you say that? Show that. Let us see, just have some idea. You know, this is the common tendinous ring of Zinn, which is giving origin to four recti. And these are the four recti coming from the region of superior orbital fissure. So this is the region of superior orbital fissure where you have common tendinous ring of Zinn giving four recti muscle inserting into sclera of the eyeball. And wherever they insert, what we have drawn is lateral rectus LR6. We have already drawn that. Then we told that wherever the rectus was inserting, just behind that, here is a thinner sclera. That will be valid for superior rectus also. And that will be valid for the medial rectus also, or inferior rectus, whichever rectus. So just have that idea. Okay, if you say so. Now, this is the common tendinous ring of Zinn. Yes. In covering the superior orbital fissure. Yes. What is passing inside that and what is passing outside that? This is some questions. If you remember, we have already discussed that some veins were passing but outside the ring of Zinn. And they were tributaries to the cavernous sinus. But one of them was having bidirectional flow. Can you tell me which one? That is the answer. So as you understand, superior ophthalmic vein is having bidirectional flow. It is not only a tributary to cavernous sinus, but it is also draining the cavernous sinus into orbit. Otherwise, the other options which you see here, all these options are just the incoming tributaries into cavernous sinus. They are just the incoming tributaries into cavernous sinus. But this is also draining channel. So we'll keep our answer as choice number A. If you say the answer is choice number A, fine. What is the next thing? This diagram. Why would you draw this diagram? Because I want to know some nerves passing through the ring of Zinn and some nerves passing outside the ring of Zinn. Okay, again the superior view of the brain, not the brain, cranial cavity. Okay, superior view of the cranial cavity. Yes, you will draw a midline of the body now. Yes, and showing the nose anterior. Yes, and then you will tell this is the left orbit and that is the right orbit. Yes, you know, when you say this is the orbit, this is the roof of the orbit, and whatever you are telling as roof of orbit is, whatever you are telling as roof of orbit is also floor of anterior cranial fossa. And we want to know some durameter at the floor of anterior cranial fossa. I want to know who is supplying this durameter at the floor of anterior cranial fossa. That is the question already. You want to know which nerve is supplying the durameter at the floor of anterior cranial fossa? Yes, that is what we want to know. So, this is the roof of orbit. Yes. But this is also floor of the anterior cranial fossa. Yes. And you want to know that which nerve supply durameter at the floor of the anterior cranial fossa. That is the question. Yes, that's what we will find out. But here you show this is the superior orbital fissure. If you say this is the superior orbital fissure, then I'll tell you that it is covered by some common tendinous ring of Zinn. Yes, common tendinous ring of Zinn, which is giving common origin for the forecti muscle covering the superior orbital fissure. We want to know some nerves which are passing inside the ring of Zinn and some nerves which are passing outside the ring of Zinn. That is the discussion. Okay, let us look at the floor of the middle cranial fossa now. And when you are talking about the floor of the middle cranial fossa, when you're talking about the floor of the middle cranial fossa, you will see there is greater wing of sphenoid. And this greater wing of sphenoid is having some opening. Namely, there was a foramen rotundum and foramen ovale. Foramen rotundum and foramen ovale. You're mentioning that this is foramen rotundum, the round foramen. Yes. And this is foramen ovale, the oval foramen. Yes. At the floor of the middle cranial fossa. Right. And the greater wing of sphenoid. I think there are some nerves passing through that. Yes, we have to discuss those nerves now. Branches of trigeminal. Yes, branches of trigeminal. Where is trigeminal nerve coming from? The brainstem. Where is the brainstem present? Posterior cranial fossa. Okay, then go to the posterior cranial fossa and show the brainstem. So this is the posterior cranial fossa, and there you are showing the brainstem. Posterior cranial fossa, you are showing brainstem. Then I'll tell you that brainstem will give you cranial nerve number 3 to 12. Is it okay? Yes, that is what we have to know. Remember, brainstem has 3 components, and which are midbrain followed by pons followed by the medulla oblongata, and present in the posterior cranial fossa. That's why cranial nerve number 3 to 12 are present in the posterior cranial fossa. Now let us follow some of them. Which one? The formula LR6SO4 remainder 3. What is this formula? Lateral rectus supplied by 6th nerve, superior oblique supplied by 4th nerve, and remaining eyeball muscle supplied by 3rd nerve. This is the formula of the eyeball skeletal muscle. Skeletal muscle of the eyeball supplied by LR6 means lateral rectus supplied by 6th nerve. Yes. And superior oblique supplied by 4th nerve. Yes. And the oculomotor supplying rest of the skeletal muscle. Yes. You want to follow nerve number 3, 4, 6? Yes, nerve number 3, 4, 6. Okay. If you want to follow the nerve number 3, 4, 6, I think they will be in the posterior cranial fossa coming from the brain stem. Yes, they are in the posterior cranial fossa and they have come from the brain stem. Now you want to follow them in the middle cranial fossa. Yes. Actually, in the middle cranial fossa, I have cavernous sinus. This is the cavernous sinus, which is in the middle cranial fossa. These nerves are passing through cavernous sinus. So let us pass them through that. This is the nerves. As you're talking about nerve number 3, 4, 6, it is not a sequence. Like, don't assume that this is nerve number 3, 4, 6. I'm randomly showing them. Randomly showing them means what? Means actually this is the number 4. So that is the number 4. Yes. Then who are these? This is the number 3 and 6. Oh, like that. Yes. Okay. If you're telling that this is the number 4 and this is the number 3, 6, fine. What are they doing? They are content of cavernous sinus. Now, their content of cavernous sinus, what will they do after the becoming content of cavernous sinus in the middle cranial fossa? They have to pass the superior orbital fissure, and 2 of them are inside the ring of Zinn and enter the orbit to supply the eyeball. One is outside the ring of Zinn to enter the orbit and supply the eyeball muscles. Who is outside? So, the number 3, 4, 6, they are now passing superior orbital fissure. As they are passing superior orbital fissure, you see the 4th nerve is left outside the ring of Zinn. Trochlear nerve is left outside the ring of Zinn. Then who is inside the ring of Zinn? 3 and 6. So you're telling that the oculomotor and abductor nerve are passing inside the ring of Zinn when they are passing through the superior orbital fissure to enter the orbit to supply the eyeball muscles? Yes. That is what we have to remember. Now, there was a case of cavernous sinus thrombosis. So what will happen? When there is a case of cavernous sinus thrombosis, there will be raised intracranial tension. So which is the earliest nerve to get involved? 6th. Whenever there is a cavernous sinus thrombosis and raised intracranial tension. So the first nerve to get involved is 6th nerve, and lateral rectus is paralyzed. That is why medial rectus became more powerful. And when the medial rectus is more powerful or unopposed, the patient was having medial squint. And this medial squint after some time was changing later in the stage of the disease, becoming still eyeball. Why it became still eyeball? Because there was what is called external ophthalmoplegia. What is external ophthalmoplegia due to? Because all the nerves have been compromised. See, in the beginning, when you're talking about cavernous sinus thrombosis, raised intracranial tension, which is the earliest nerve to get involved? The 6th nerve. If you say 6th is the first involved, fine, lateral rectus is gone. But then medial rectus became more powerful, leading to medial squint. But later, you will find that other nerves are also gone. You mean to say number 4 is gone and number 3 is gone? Yes. And that time, all the muscles of the eyeball will be paralyzed, called as external ophthalmoplegia, and eyeball will come back to neutral position. This is what we have discussed. This will be the later stage of the disease, cavernous sinus thrombosis. Okay, if you say so, we'll believe that. What about the pons giving trigeminal nerve? And here are the pons. As you're talking about the pons giving the trigeminal nerve, this is the trigeminal nerve coming out and giving a ganglion at the floor of the middle cranial fossa. You're talking about the trigeminal nerve coming from the pons. Yes. This is trigeminal nerve, the 5th nerve, coming from the pons. And As the trigeminal nerve came from the pons, it is going to the floor of the middle cranial fossa. And what is happening at the floor of the middle cranial fossa? At the floor of middle cranial fossa, it has a ganglion which is called trigeminal ganglion. And trigeminal ganglion is actually giving three branches, one here, and one there. What are the three branches? Actually, I have got phi 3, which is mandibular nerve branch of the trigeminal, passing foramen ovale to supply mandible bone. And what is this? This is phi 2, which is maxillary nerve, passing through foramen rotundum to supply the bone maxilla. And this is phi 1. What is phi 1? That is the ophthalmic division trigeminal. So you're telling that this is pons, yes, giving trigeminal nerve, which is giving three branches, yes, at the floor of the middle cranial fossa, right. If phi 1, ophthalmic division of trigeminal, phi 2, it is maxillary nerve supplying the bone maxilla, but before it supply the bone maxilla has to pass through the foramen rotundum, and this is the mandibular nerve phi 3, which is going to supply the bone mandible, but before that it has to pass the foramen ovale. Can you discuss more about the phi 1 ophthalmic? Yes, let us discuss phi 1 ophthalmic. If you remember, we have discussed phi 1 ophthalmic division of the trigeminal is going to give us three branches which will be passing superior orbital fissure to enter the orbit. You are telling that this is the ophthalmic division of trigeminal giving three sensory branches which will be passing the superior orbital fissure to enter orbit. Yes. Can you tell me what are the three branches of the ophthalmic trigeminal nerve then? And who is passing inside the ring of Zinn? Who is outside the ring of Zinn? This is the discussion. You see, this is the N. What is N? The nasociliary nerve. This is the N, the nasociliary nerve supplying the cornea of the eyeball. If you say it is nasociliary nerve supplying the cornea of the eyeball, touch the cornea and the reflex is carried by. Touch the cornea and reflex is carried by nasociliary nerve, branch of the ophthalmic nerve, branch of the trigeminal nerve. It's passing through the ring of Zinn. If it is passing through the ring of Zinn, then what about the other branches of ophthalmic trigeminal? They are actually outside the ring of Zinn to enter the orbit. So they'll be outside the ring of Zinn to enter the orbit. What is the name? Most lateral is lacrimal. So most lateral is lacrimal nerve. Yes. And what is in the middle? In the middle, I have the frontal nerve. So you are talking about three branches of ophthalmic trigeminal. Yes, you see here. This is the trigeminal ganglion. Yes. And it is giving the ophthalmic nerve, and it is giving three branches, which is the most lateral, the lacrimal, which is in the middle, the frontal, and which is most medial, the nasociliary nerve, which is actually passing inside the ring of Zinn and supplying the cornea of the eyeball, carrying corneal reflex. So you're telling a mnemonic now. Your mnemonic is LFT nerves are left outside the ring of Zinn. LFT nerves are left outside the ring of Zinn. L for lacrimal, F for frontal, and T for trochlear. So you are telling L for lacrimal, F for frontal, and T for trochlear. LFT nerves are left outside the ring of Zinn. Then who is inside the ring of Zinn? Now number 3, 6 and nasociliary nerve. So the number 3, 6 and nasociliary nerve are inside the ring of Zinn. There are 6 nerves passing the superior orbital fissure, and 3 are inside and 3 are outside the ring of Zinn. So there are 6 nerves passing superior orbital fissure, and 3 are inside the ring and 3 are outside the ring. Who is inside the ring of Zinn? The number 3, 6. And who is the third one? Nasociliary nerve, branch of trigeminal, ophthalmic. And who is outside? The mnemonic. LFT nerves are left outside the ring of Zinn. L for lacrimal, F for frontal, and T for trochlear. That we will see in the diagram now. But remember, when the ophthalmic nerve, this oculomotor nerve, passes through the ring of Zinn, it would have already divided into 2 divisions. What 2 divisions? Ophthalmic, the oculomotor nerve, when it is passing inside the ring of Zinn, would have divided into two divisions. What is the two division? Actually, there is a superior division and there's one inferior division. Superior division of oculomotor supplies superior rectus and inferior division supply inferior rectus. You are trying to say, when we look inside the ring of Zinn, there will be two divisions of oculomotor nerve? Yes, actually, superior division to supply superior rectus, inferior division to supply inferior rectus. I cannot understand nothing. What is happening? If you cannot understand, then let us look at one diagram. Then you'll understand. Okay, where is the diagram? Okay, we'll see. We'll see the diagram. But before that, did you find what is this nerve supplying the durameter at the floor of anterocranial fossa? Not yet. So what are you doing? Find that. And that nerve is called as the anterior ethmoidal nerve. Anterior ethmoidal nerve is going to supply nose inside outside and also the durameter at the floor of anterior cranial fossa. Now you are talking about some anterior ethmoidal nerve. Yes. An anterior ethmoidal nerve is supplying the nose inside and outside. Yes. And it is also supplying some durameter which is at the floor of the anterior cranial fossa. Where it came from? Let us see. And it is actually a branch of the nasociliary nerve and given in the orbit and coming out of the orbit to enter the floor of anterocranial fossa and then go to supply the nose. What is the course of anterior ethmoidal nerve? Anterior ethmoidal nerve was given in the orbit by and the nasociliary nerve. And how does it exit the orbit? Passing some ethmoidal foramen. So as it is passing through ethmoidal foramen, where it will come to the floor of the anterior cranial fossa, supply durameter at the floor of the anterior cranial fossa and then go into the nose, supply the nose inside outside. It will supply the bone of the nose also. Which bone? Ethmoid bone. So will it supply ethmoid air sinus also? Yes. And whenever there is ethmoid air sinusitis, the pain can be carried by same nerve. You mean to say anterior ethmoidal nerve? Yes, that came as a question. Remember. Anterior ethmoidal nerve is supplying the bone of the nose and also the sinus, which is the bone of nose, ethmoid bone. And what is the sinus? Ethmoid air sinus. It was having some sinusitis. The pain is now carried by anterior ethmoidal nerve towards the nasociliary nerve, towards the ophthalmic nerve branch of trigeminal, towards the trigeminal nerve, towards a nucleus. Do you remember the name of nucleus? Which nucleus is carrying the pain of the face? Remember, name of nucleus. The nucleus which was actually entering the spinal cord. Oh, you are talking about spinal sensory nucleus of trigeminal. Yes, carrying pain temperature from the same side of the face. Yes, which is extending into the spinal cord. Yes, if you remember, passes the lateral medulla. Involved in lateral medullary ischemia. Wellenberg syndrome leading to loss of pain temperature on the same side of the face, if you remember. That is where the pain of the ethmoid sinusitis will come. You are telling pain of ethmoid sinusitis is the pain of the face? Yes. And pain of the face is received by spinal sensory nucleus of trigeminal, which is passing lateral medulla. Yes. And compromise in Wellenberg syndrome. That's why in Wellenberg syndrome, there is some loss of pain temperature on the same side of the face. What is the purpose of this diagram? Purpose is very simple. Purpose was, how do you carry the pain of ethmoid sinusitis? So pain of ethmoid sinusitis is carried by branch called anterior ethmoidal nerve towards the nerve called nasociliary nerve, towards the nerve which is called ophthalmic trigeminal, towards the trigeminal nerve and towards the spinal sensory nucleus of the trigeminal. That is all we wanted to discuss here. Okay. What about that fissure you were telling some nerves inside outside? Yes. That diagram is now coming up. Okay, show me the diagram. But before that, the question has come. Anterior-thyroidal nerve. You know this nerve? Anterior-thyroidal nerve, which is a branch of. Nasal nerve is a branch of. Ophthalmic nerve, which is a branch of. Trigeminal nerve is all except. So you're telling anterior-thyroidal nerve is a branch of nasal nerve, is a branch of ophthalmic nerve, is a branch of trigeminal nerve. Yes. What is it not supplying? I think it is supplying dura mater, floor of anterior fossa. Correct. I think it is supplying thyroid air sinus, carrying the pain of thyroid air sinusitis. Yes. And it is supplying nose inside outside. Yes, nose inside outside will supply. So you mean to say this is the answer? Yes, that is the answer. Because understand, maxillary sinusitis, pain is carried by branches of maxillary nerve, not the ophthalmic nerve. So maxillary nerve sinusitis, maxillary sinusitis pain will be carried by branches of maxillary nerve, not the branches of ophthalmic trigeminal. This is ophthalmic trigeminal and this is the maxillary trigeminal. So this is the exception. Yes. Okay, if you say so. We'll keep this answer and then we are moving on to the superior orbital fissure, some nerves passing inside, some nerves outside. Which superior orbital fissure you are looking at? I'm looking at left superior orbital fissure. But before you look at the left superior orbital fissure, quickly recapitulate. What is this bone? Cribriform plate ethmoid. What is this bone? This is the roof of orbit frontal bone. And what is this bone? That must be the lesser wing of sphenoid, the floor of ventricular fossa, roof of the orbit. And what is this bone? Having 3 opening. That must be the greater wing of sphenoid, having 3 opening. And what is the gap between the two? Gap. Yes, gap, I know. Superior orbital fissure. Let us look at the left superior orbital fissure from the posterior view and see the details. See here. If you remember, we have discussed this is the common tendinous ring of Zinn, which is giving origin to superior rectus and lateral rectus and inferior rectus and medial rectus and this is the LFT nerves left outside the ring of Zinn. If you say this is LFT nerve left outside the ring of Zinn, which is the most lateral, the lacrimal. Who is in the middle? The frontal. And who is medial? The trochlear nerve. So LFT nerves left outside the ring of Zinn? Yes. Then who is inside the ring of Zinn? Who is inside the ring of Zinn is the number 3, 6 and nasal ciliary. If you say it is the number 3, 6 and nasal ciliary, where is nasal ciliary now? I cannot see. It is here. If you say this is nasal ciliary, then why I am seeing 4 nerves here? There should be 3 nerves. No, I told you one thing. Nasal ciliary nerve is passing through the ring of Zinn, but when the oculomotor is concerned, you will find oculomotor has a superior division and it also has the inferior division. You mean to say superior division supplying the superior rectus muscle, yes, superior rectus muscle, and inferior division supplying the inferior rectus muscle, yes, inferior rectus muscle. That is why. Understand, when the third nerve is passing through the ring of Zinn, it has 2 divisions. So when the third nerve is passing through the ring of Zinn, it has 2 divisions. They are superior division to supply this superior muscle, superior rectus, and then there is one inferior division which is supplying the inferior rectus. Okay, so there are actually 4 nerves inside the ring of Zinn now. Yes, 2 division of oculomotor are also there. Anyhow, what is this? This is nasal ciliary nerve supplying the cornea. Touch the cornea, it is will be activated. That is the nerve. I think there are some veins also passing through the superior orbital fissure, namely superior ophthalmic, inferior ophthalmic, and superior ophthalmic vein is lateral. Yes, it was lateral and it has bidirectional flow. It is a tributary to cavernous sinus and it is also a draining channel for cavernous sinus. Can bring the staph aureus back into cavernous sinus, causing thrombosis. I think they are inside the ring of Zinn. Inside? No. If they go inside the ring of Zinn, they might be compressed. They don't want to go into crowded places. They avoid crowded places. So they stay outside the ring of Zinn. They don't want to get compressed by going there. They are passing superior orbital fissure, but outside the ring of Zinn. And that is why, what is the answer to this question? Structure passing through, what is through? Through means inside. Oh, inside, then I know the answer. What is your answer? I know that superior ophthalmic vein and inferior ophthalmic vein are usually left outside the ring of Zinn. So trochlear nerve and the lacrimal nerve, this is a mnemonic. LFT nerves are left outside the ring of Zinn. If you say LFT nerves are left outside the ring of Zinn, you mean to say the answer is nasal ciliary? Yes, nasal ciliary is passing through the ring of Zinn. That is the answer.